in Winter Garden. We're going to be talking about RSV today. So thank you so much for being a part of our lung chat.
Hi, good morning. Thanks for having me.
Absolutely. So, RSV really exploded recently. This is something that has been around for a very long time. But can you talk to us a little bit? Let's just start for especially parents who are very curious about this, little kids, kids going back to school, that there's certainly been a lot of buzz around RSV, but let's start with the basics. What is RSV?
So RSV is short for respiratory syncytial virus. It's just like you're saying, it's been around. It is around every year, but it typically circulates during this time of the year, during fall, throughout the spring, though we do see some cases circulate throughout the rest of the year too. I think some of the buzz around it this year has been particularly because of COVID, and there are some concerns about co-infection rates and things like that. But certainly every fall to spring, we do talk about RSV as RSV season.
Absolutely. And so what exactly causes RSV?
So RSV, again, short for respiratory syncytial virus, it's a respiratory virus that can cause the common cold, and it basically is a respiratory virus that can spread from person to person. It's caused by spread through an infected individual, for example, through respiratory droplets or mucus, saliva. It's actually also pretty hardy, so it can live on things like surfaces. So if you touch a dirty doorknob or other shared object, or if you shake hands with somebody who has a contaminated hand, you can actually contract it that way.
It definitely spreads super duper easy. And we've certainly all been conscious of this throughout COVID-19, but certainly I know we saw some loosening of people kind of putting their guard down a little bit, but we definitely have to keep our hands clean, keep our surfaces clean. So yeah, certainly it sounds like anybody can contract RSV, but who would you say is most at risk of contracting it?
Sure. So like I was starting to say before, even older individuals can get it. Older kids, adults, and they usually experience it more as a common cold, right? We get like the fever and runny nose and cough, congestion from something like RSV as an upper respiratory tract infection. But the higher risk population would be, for example, the smallest babies, perhaps newborns or premature babies, those with certain heart and lung conditions or immunodeficiencies. Those patient populations are most at risk for more severe illness, whereas they don't only just get those cold symptoms. If the virus migrates down to the lower respiratory tract, it can cause infection and inflammation of the smaller airways, smaller lower airways, and we call that bronchiolitis. And that does manifest in the, like I was saying, the younger babies.
Yeah, definitely. Something that I know a lot of parents are, concerned about and have a lot of questions on. So, if a parent, let's say, has a little one that they're suspecting it might be
Mhm.
RSV, or what could this
Sure.
be? How do you go about diagnosing RSV?
So the diagnosis of RSV is typically clinical. There are tests that we can do. For example, a nose swab. There are nose swabs that we can do even in office to test for RSV. And in certain cases, we even do chest x-rays for the more complex cases. But we don't actually always do the testing, because it doesn't necessarily change medical management. Medical management is typically supportive. So what I tell parents at home, if they call saying that their kiddo has a cold and they're not sure if this is RSV or something of the sort, I tell them to look for certain things. So besides looking for those common cold symptoms, my concern mostly is if they're having trouble breathing, which might manifest as the nostrils flaring open and shut, the head bobbing with each breath, the ribs pulling in and out or retracting, belly breathing, fast breathing, or a child who looks listless, really fatigued. Those kiddos I'm more worried about, and with that clinical picture, we say, oh, maybe this could be RSV or RSV bronchiolitis.
Yeah, definitely. Great tips for parents who are concerned and are not quite sure what to look for. So, if in fact a child is diagnosed with RSV, how do you actually treat that?
So, for better or worse, the mainstay of treatment for RSV is mainly supportive, or the tincture of time. We expect, just like many other respiratory viruses, the RSV virus can take a couple of weeks to run through its course. The first week is usually kind of the worst, and then you might still notice some coughing and some congestion the second, maybe even into the third week in terms of like a post-viral lingering cough. But the main peak of RSV usually is days 3 to 5. So in those few days, I explain to parents that it's important to keep the child comfortable, make sure that your child is well hydrated. Depending on the age group, things like honey for a cough for the kiddos above the age of 1 year could be helpful for a cough, or nasal suctioning, nasal saline. Those supportive measures can be really helpful to take care of the symptoms of RSV. But otherwise, we have to just let it run its course usually.
And not always something a parent wants to hear of, just let it go. But
Yeah.
it's certainly for all of us when it comes to the common cold that we just have to work through it and keep our eye out for the more severe symptoms and be able to call you or their pediatrician.
Mhm.
So I know one of the big questions on parents' minds right now, we're talking about back to school, things are
Yeah.
back to, I don't want to call it normal, but
Right.
we're getting kind of that way. So a lot of parents are wondering, how can I prevent RSV from impacting my kid?
Yeah, so for a very, very small subset of patients, the highest risk patients, premature babies, like really premature babies, or those with very certain heart, lung conditions. Just for example, there is a medication that we give during RSV season. It's an injectable medication called pelavizumab or Synagis, but that's a very small subset of patients with certain criteria met. Otherwise, just like we were talking about, hand washing goes a long way, disinfecting shared surfaces goes a long way. Don't be out and about in the community when you're sick, because whether it's COVID or RSV, you don't want to be spreading it. It is always important to get your flu shot every flu season. We don't need a co-infection or other viruses circulating in the community that are vaccine preventable. We also want to make sure that any kids and caregivers, besides being up to date on the flu vaccine, for example, the whooping cough vaccine is another one that needs to be up to date. And then, as you were mentioning, with COVID the past, I don't know, how long has it been now? Like year and a half, just lingering a little bit. Just like we've been doing for COVID. As I was saying before, social distancing, super important, and wearing a face mask. Face masks can be very helpful in terms of risk mitigation for limiting the spread of disease for any respiratory virus, really. So mask wearing, hand washing, social distancing, all good things still for RSV too.
This has all been really wonderful information, and I'm sure parents are going to find this extremely helpful. So if parents do have some follow-up questions, where can they find more information with Advent, and where can they find you?
Sure, absolutely. So our website. It has a listing of all the local or the doctors that might be local to families. I myself am out in Winter Garden off Stony Brook West Parkway, or West Stony Brook Parkway, excuse me. And we're taking new patients. And it's really important to be able to have discussions with your pediatrician about things like this if there are concerns during RSV season, because you want to have a good resource that's readily accessible, readily available to you. So your pediatrician really is your best bet for answering some of these questions. And also, I find the American Academy of Pediatrics website, which is laid out in layman's terms for parents, is super helpful. That's healthychildren.org, and that's their website for information for parents.
That is all wonderful information, and I will add that you are also welcome to visit lung.org, that there is an entire section of our website dedicated to RSV for additional questions. But Dr. Li, thank you so much. I think you were incredibly well-spoken on this topic. You made it really easy for the layperson to be able to understand what's going on, how we can manage this and prevent it. So thank you so much for your time today.
Absolutely. Happy to be helpful. Thanks.
All right, thank you. So be sure to connect with us. We will be posting our next lung chat in September, but if you have any follow-up questions, message us. If you have any questions for Dr. Li, you can always reach out to, of course, the Lung Association to help get in touch with her. And of course, make sure to visit AdventHealth's website for more information as well. Thanks for your time today. The AdventHealth Medical Group